So good afternoon and welcome to Vaccinations and the Workplace, Questions in the Time of COVID-19. My name is Becca Bolas and I am Executive Director of Maine Public Health Association. For those that are not familiar with us, we are a statewide nonprofit organization and we conduct public health education, advocacy, and professional development activities. If you'd like to learn more about our work, you can visit www.mainepublichealth.org. We're excited to be co-hosting today's webinar with the Maine Association of Nonprofits, and I want to thank Molly for being here on today. And you can learn more about MAMP's work at nonprofitmaine.org. I do want to let everyone know that we are recording today's webinar, so if you are not comfortable being on a recorded webinar, you can certainly turn off your video, or you can hop off the webinar, and we will, because we are recording it, we'll be sharing the recording and posting it online, so you can view it later if that is your preference. In the interest of time, we do ask that if you have any questions while Anne-Marie is talking, that you put them in the chat and you can direct them straight to me, and that way it may be a little bit less distracting so you don't constantly see the pop-up of the chat for other folks that are in the room. If you did submit a question in advance, I have shared those with her. And Dr. Sears from Maine CDC is here to answer some of the questions that came in that were a little bit outside the scope, but certainly understand that they're questions that folks have. So we'll save some time at the end to hear from him. And so with all of that, I will introduce today's presenter. We have Anne-Marie Storey, who is an attorney at law at Rudman Winchell. Anne-Marie practices employment law, including the general advising of employers, litigation, administrative actions, training, and workers' compensation. We're very grateful for your time and for being here, Anne-Marie, so thank you very much. This is such an important and certainly timely topic. And with that, I will turn it over to you.
Hi, good afternoon. Thank you. Thanks for having me. I'm pleased to be here. Of course, we are talking about almost nothing but this at this point, and so I'm happy to share with everybody. I do have a bunch of the questions that you sent that people have already sent in, and so for everybody's purpose out there, I'm happy to answer whatever questions you have. I'm going to try and get to them all. We did talk about how to set today up, and it seemed like it would be best to do to start off with sort of a short where we are now and what the issues are and what the current guidelines and regulations all say, and then jump into the questions just to make sure everybody's sort of starting from the same base point and understanding what the guidances are and the requirements are. So that's what I'm going to start with, but again, feel free to put your questions up and I'll get to as many as I can. There were a few I saw that are either not employment related, so I will not be addressing those, or as you know, sometimes questions are so specific and clearly related to a specific fact and incident that I cannot answer them because of potential conflicts or whatever. So I may defer on some of the questions, but I'll try and get to them all. So let's sort of talk about where we are now in terms of masking and vaccinations and status in the workplace. There are a variety of entities that are guiding us, guiding employers at this point, and you really need to know what all of those entities are saying at any one time. And it can be a little bit confusing to keep them all straight. So I'm going to go through the current status. So as of the end of May, or toward the end of May, the federal CDC has had issued some revised guidelines, and I'm sure that most of you, if not all of you, are familiar with those at this point. They are the ones who said that fully vaccinated individuals, and I want to start off by being very clear about what that means. So that means people who have received both shots or the one shot from the Johnson & Johnson and have completed their waiting period. So these are not people who are in the midst of having the vaccination process done. But for fully vaccinated people, they no longer need to wear a mask, and they no longer need to follow the guidances on the other activities, for instance, staying 6 feet apart and other social distancing and cleaning and all of those kinds of things. However, so I should say, when that came out, there was a lot of excitement, obviously, by people, a lot of employers about what to do and how to bring people back. But that's not the end of the story, because there are still several other things we need to look at. What the federal CDC said was, this is our rule or our guidance. However, we are deferring in the event that there are different rules that have been set forth by other federal entities or state or a variety of other things, including policies set by local businesses and workplaces. So what that means is the CDC is saying it is okay to unmask for fully vaccinated people, and you no longer need to follow the other social distancing guidelines. But they're not saying to employers, this is what you have to do. They're not saying you must let everybody who's fully vaccinated into your workplace unmask. Quite to the contrary, what they are saying is, here's our approach to this. You may still do what you want to do, and well, you have to follow, if there's other guidances out there, you have to follow those, or you may follow your own policies, whatever you decide those are going to be. So just to follow up on the CDC just a little bit more, what that means is, for fully vaccinated people, you no longer have to quarantine or test followed a known exposure to somebody with COVID, as long as that person is asymptomatic. Or if the person is symptomatic, then they are still suggesting that you follow the procedures that we were following before, including testing. They're also saying that you can refrain from routine screening if folks are symptomatic or asymptomatic. So for instance, the temperature taking, if you're doing that, you no longer need to do that for fully vaccinated people. What that means for the workspace, at least according to the CDC guidance, is that you may have people in your workspace who are fully vaccinated, who are not wearing masks and who are not social distancing. But for those people who are not fully vaccinated, they need to continue to do those things. And this presents some complications for employers, because you may have a mixed workplace. Most employers do have people who are vaccinated and people who are not vaccinated. That means they end up with a workspace or a let's take, for instance, a lunchroom, where you have people in the room who are not masking, but you have people in the room who are going to have to continue to mask. And I've already heard from many employers that this is creating issues in terms of employee morale and some disgruntlement. But that's what the CDC says you have to do. So, and we're going to get into issues about how do you figure out whether somebody's vaccinated or not and what to do about that. I'm just talking about the very sort of baseline here. So for fully vaccinated people, they can be in the workplace unmasked. They do not need to do the social distancing. They, so if you haven't reviewed the CDC guidance, you really need to do that, because there's a lot of very specific information about a variety of different things that might come up. Like they talk specifically about small group meetings and how those can be conducted. They talk about outdoor work and what they recommend in terms of masking and whatnot there. They talk about business travel, and that's particularly important for those of you who are starting to travel again. So I would encourage you to keep an eye on that. Now, I mentioned, so that's sort of a very broad overview of what the CDC is currently saying. That's complicated by guidances from other entities. And the first one I want to talk about is OSHA, because from the beginning of this, I have been talking, as have many other attorneys, about your obligations as employers to not run afoul of OSHA's general duty clause, which requires you to keep your workplace as safe as you can keep it. And what we've been saying from the very beginning is that one way to show that you're complying with your general duty clause is to follow whatever the CDC is saying in terms of its recommendations for how to keep your workplace safe. So now you can see this conundrum that OSHA is saying we defer to the CDC, The CDC is now saying you can have vaccinated people unmasked, but there are still concerns by a lot of employees and employers about what's happening in the workplace, and should I really have people unmasked, or is that safe, and what's the perception of that? And OSHA has not updated, has not issued a formal guidance updating its policies and procedures and guidances about what it requires. So it was a little bit unknown immediately after the CDC guidance came out, until OSHA did put some information on its website. And as far as I know, this has not changed or been updated. But what they posted this little blurb on the site, and it says that they're in the process of reviewing the CDC guidance and will update their materials accordingly. Until those, this is what it says, until those updates are complete, please refer to the CDC guidance for information on measures appropriate to protect fully vaccinated workers. So what that says to me is OSHA is giving you a green light to follow CDC guidelines for fully vaccinated people, meaning they don't have to wear masks in the workplace. And if they're not wearing masks, OSHA is not going to come after you because of that. However, this blurb from OSHA does not address unvaccinated people. And I think it's very clear that unvaccinated people need to continue to be masked and follow all the other procedures that we've had in place in the workplace. So that's how those two fit together. Now, that's not all though, because now we have to throw in what the state is doing. And as of May 19, as I'm sure you know, the governor issued an executive order that became effective on May 24. And that executive order repealed the prior face covering orders requiring that they be worn in public settings. Basically, what it says is we are not going to implement two separate policies, one for vaccinated people and one for non-vaccinated people. And so the state is no longer requiring face masks, and the DECD has retired their checklists, also effective May 24. Those were the checklists that set forth guidances for businesses and others about what to do with social distancing, what was required for capacities at businesses, all of those things. So those have all been retired. So as I understand it, from the state's perspective, as of May 24, they're not really taking a position on whether or not people need to be masked or not in the workplace, regardless of vaccination status. Instead, it is up to the employer or the business to make that determination on its own. So now we have these three pieces that we have to figure out how they fit together for each workplace. And the way I view this is for vaccinated people, including your employees, you may allow them to be in the workspace without face masks, and you will not violate the CDC or OSHA or the state executive order by doing that. However, if you have unvaccinated employees, you must still have them masked and follow the other social distancing and other guidelines. And I think that's true under the CDC and OSHA, and I think it's the best practice under Maine's executive order. So that's where I think we come out on the current status. Now, that's great, and that from a theoretical perspective. But most of the questions I get are, okay, fine, if those are the rules, how am I supposed to enforce them? What am I supposed to do in terms of asking for information about vaccination? How do I get that information? And a lot of the questions that people had submitted ahead of time were specific to that issue. Excuse me. So let's talk about that. You, as an employer, you are permitted and you are not prohibited by the ADA or other anti-discrimination laws from asking for proof of vaccination. There's nothing in the CDC that prohibits you from asking for that information. And in fact, the Maine is, while they're not requiring any employer or any business to see proof of vaccination, they do not prohibit you from asking for that information either of your employees. So I think the status is you are permitted to ask your employees to show documentation that they have been fully vaccinated if they want to unmask in the workplace. So what are the other potential problems with that? Well, you have to be careful about what information you're asking for. I think it's pretty clear that the only thing you should be asking for if you are going to ask for that proof is the vaccination card. There's no reason to have any other documentation. And in fact, you are running the risk of violating the ADA and potentially some other laws if you do ask for different and more extensive information. Everybody should have the vaccination card, and that's all you need as proof of vaccination. So you are permitted to do that. Now, that doesn't necessarily mean that you want to do that. And again, that's a choice that each employer is entitled to make. What you should do is decide one way or the other whether you're going to ask for it or whether you're not going to ask for it, and be consistent. So you can't ask certain people for proof and not other people. So if you've got an employee that you know is going to tell you the truth and you say, well, I'm not going to ask that person, but there's somebody sketchy over here and you're not really sure if they're going to tell you the truth or not, you cannot pick and choose. So you're either going to ask for documentation from everybody or from nobody. I can tell you my own experience within the last couple of weeks is most of the employers that I have talked to about this are not requiring proof of vaccination. And the reason is, number one, there's a fear about asking for information that has anything medical about it, because, you know, we're always telling you, you don't want medical information unless you really have to have it. And number two, there's a feeling that asking someone to prove that could affect employee morale in the sense that it looks like you don't trust your employees. I think those are both, I mean, you make your own decision about whether those are valid reasons and whether you want to follow them or whether you want to ask. If you are not going to require proof of vaccination, though, I think it's important to have an employee affirm that they have been fully vaccinated, because you're now relying on their veracity to tell you the truth, because you don't want to end up in a situation where somebody has been untruthful about it and you find out later and that person's potentially put people at risk. Although, again, you know, as a practical matter, if you have somebody, if everybody who is unmasked is vaccinated, then if you have one person who's not told the truth about it, they really shouldn't be able to negatively impact the vaccinated people because they're vaccinated. But at any rate, I just think you want to make an effort to be sure that you have a policy that says the only people who can unmask are those people who are vaccinated. And if you are vaccinated, you are essentially affirming to us that you have that status. So we're relying on you to tell us the truth. If you do ask for proof of the vaccination, like I said, you would limit it to the vaccination card. I don't think there's any need to keep a copy. You take a copy of the card or keep a copy of the card. I think it's enough just to have seen it and affirm that it was accurate. If you do, for whatever reason, decide to keep a copy of that card, that is protected medical information, and that should go in a separate place that is confidential, just like any other medical information you might have about an employee, okay? Now, one question that sometimes flows from that information about vaccinating or whether you ask for proof is, can I have people wear something or some way outwardly demonstrate, other than the fact that they don't have a mask on, that they have been vaccinated, like a pen or a, you know, like the voting sticker that says, yay, I voted, to have one that says, yay, I'm vaccinated, something like that. My feeling about that is that you should not, and that's for a couple reasons. Again, number one is the status of being vaccinated is well, could be viewed as medical information. Now, the fact that somebody doesn't have a mask on is pretty much making the same statement, but I don't think advertising it like that is necessarily a good idea. The other reason is because if you have employees who are not able to be vaccinated because of a health issue and are therefore potentially or definitely protected under the ADA, or you have people who have chosen not to be vaccinated because of another protected reason like religion, which is a protected reason to not be vaccinated under Title VII, then I don't think you want to do things that further single out those people, because you don't want to be viewed as retaliating against somebody who is unable to be vaccinated because of a protected reason. Okay, so there's that. Now there is, well, again, there are confidentiality issues, and you certainly don't want to prompt questions to somebody about vaccination status. I did want to point out, this is kind of a random thought in the middle of all this, but it's important to mention the fact that well, so let me start with this. You probably all know that there have been a variety of reasonable accommodation issues that have come up based on COVID and vaccinations and whatnot. And some of those are people who either can't be in the workplace for health reasons or don't want to be in a workplace because of possible health issues. And so you may have had a situation where somebody asked for a reasonable accommodation, like for instance, working from home or something like that. The fact that a lot of people are vaccinated now does not necessarily mean that reasonable accommodations are no longer going to be an issue. And in fact, the CDC has been very clear that even somebody who has been vaccinated could still potentially be entitled to a reasonable accommodation. Because as we know, none of the vaccinations are 100% sure that they'll protect against the known versions we have now or anything else that might be out there. So somebody may still be, for instance, immunocompromised, and their doctor is saying, you even though you're vaccinated, even though there are people in your workplace who are vaccinated, you should still not be there full time. And so maybe that person needs a reasonable accommodation to continue to be remote for some period of time, or some other form of accommodation. You know, the possibilities are endless, but I just wanted to raise it because I don't want people to forget that just because people are vaccinated means there's no more reasonable accommodation issues. Now, of course, a lot of the big discussion lately has been, what about incentives so that I can get my folks vaccinated? And fortunately, we went through a period of time where the answer to that was a little unclear, and we didn't really have much guidance from any of the federal entities about whether or not that was okay or whether it wasn't okay. And even if it was okay, what's a reasonable incentive, what's good, what's bad, what's too much. We now have some guidance from the EEOC. They have updated their question and answer section on their website. If you have not reviewed it, I would recommend that you do that, because there's a lot of good information in there. So they have responded specifically to some of these incentive questions. And basically what they have said is, if it really all comes down to whether or not you are the entity who is providing the vaccination, either directly or through a third party that you contract with. If you are doing that, then you are limited in the kind of incentive that you can offer. The EEOC question and answer does not define what limited means, but it's underlined, and so it's important, and it means limited. So you know, I don't, again, there's no bright line about what's too much, what's not enough. I'm thinking, you know, minimal gift cards to Starbucks or some place like that, or maybe limited just to the time off it takes, you know, like a paid time off for the time it actually takes to be vaccinated. Those kinds of incentives, maybe a luncheon for people who have been vaccinated, that kind of thing. On the other hand, though, if you are an employer who has absolutely nothing to do with the vaccination, and your employees are being vaccinated, you know, at one of the sites, the hospital sites, or any of those public areas, and you as the employer have no relationship to that at all, the employee did it completely on their own, as with most employers, I think, then the EEOC has said that they are not putting limits on what your incentives can be. I still don't think that it's a good idea for an employer to go crazy and offer, these massive incentives that I have seen a few of in the news. Most of them I think are pretty reasonable, but I would keep it under control if you do plan to offer an incentive, partly because of what we talked about before, which is you may have people in your workplace who are unable to have the vaccination, not just unwilling, because that's a choice, but unable, either for a medical reason or a religious reason. And I don't think you want to put that person in the position of feeling quite so left out that you're giving these massive incentives to people that they can't possibly participate in. So I do think that's something to keep in mind. Now, so that's my sort of half hour, here's everything you need to know in a nutshell about where we are with vaccinations and the various entities. I haven't seen any specific questions pop up, so I think I could just keep talking, but in the interest of addressing what specifically people want to hear, Becca, I thought maybe I would just sort of start through the questions that you had sent, and those may prompt some for other folks as well.
Yeah, I think exactly right. Thanks,
okay.
Anne Marie.
And some of these I may have answered in sort of the general summary I just gave, but we'll see as we go through them. So the first one was, what are the pros and cons of requiring employees to be vaccinated to return to in-person work? Well, that's a big question. Let me start with the cons, of course, because I always, those of you who know me know I always like to point out the bad news first. So among the cons, of course, are the fact that, well, at its very basic level, if you take a stand and you say all of my employees must be vaccinated or you cannot come back to work, you may, and just let me be clear, you are permitted to do that. However, if there are people who have protected reasons why they cannot be vaccinated, you must make accommodation for those people. So that's point number one. Number two is, if you draw that kind of line in the sand, you have to be prepared to enforce it. So if you are going to say, I want everybody in my workplace vaccinated, and that's all there is to it, assuming that nobody can opt out because of a protected reason, if you have people who just say to you, well, that's great that you think that, but I don't want to be vaccinated, I'm not going to be, then you're going to have to be prepared to deal with the consequences. And the consequence of that could very well be that you have to terminate that person for failure to follow a work rule. And so I want employers to think through ahead of time, are you willing to lose potential employees, especially in the situation we're in now, where workers can be very difficult to find? Are you willing to lose employees in order to enforce a full vaccination policy? So that's the second thing. And then the third consideration that I can think of right off the bat would be workers' comp, because that's sort of still always hanging out there. And I want to make sure people remember to take that into consideration. So the way that would come into play here is that if you say to your employees, you may not come back unless you're fully vaccinated, and an employee goes and gets the vaccination and has a bad reaction to it, it's possible that situation that would be considered work-related under your workers' comp. And the argument from the employee would be, well, I didn't have any choice. It was a condition of my employment, and therefore it was not voluntary. It was a requirement, and therefore it's work-related and you're responsible for it. And I think that could very well result in an award against you for the employee if there were negative consequences. So and again, those are all factual situations that you would have to deal with on a case-by-case basis, but it's certainly a possibility that you need to be aware of. Now, I'm getting stressed out by all the things that are coming up on the chat.
I got it covered. Don't worry.
Okay. because I know there's some that are going past and I'm not going to see them. So I'll rely on you to let me know what they are. Okay. I mean, the pros of requiring people to be vaccinated to return to work, aside from the obvious ones, that you've got everybody in the workplace vaccinated and there's less risk of having people contracted through the workplace or losing people because they're out due to having COVID. One of the sort of lesser thought about benefits, of course, is that you also don't have people who are feeling singled out, because again, you may end up in a normal workplace with a lunchroom filled with all vaccinated people and one unvaccinated person, which means that person's the only one in the room that has to wear a mask, which means that person is probably feeling uncomfortable and may actually get questions from people that they shouldn't be asking, like, hey, why aren't you vaccinated? So so that, you know, that's obviously one of the pros, and a couple of the pros. I'm sure there are more that I'll think of as we go along, or if you folks want to share, or most likely I'll think of after we finish. But at any rate, those are some pros and cons. So the next question was, what about volunteers and or clients? Can and should we require vaccination? So again, you know, this presentation is meant to address the employee-employer relationship. And so volunteers and clients are really going to be outside the scope of that. But you know, I think I can say as much as the CDC rules and the state of Maine executive order and OSHA, well, not OSHA because they're not employees, but all of those probably apply the same way in terms of at least volunteers. For people coming into your workplace, and you know, the same sort of rules apply. You are not prohibited under Maine's executive order from requiring masks for people coming into your place of business. And that's you know, that's up to you. Again, that's each employer needs to come up with their own policy. And as I'm sure you know, you can walk down any main street and some businesses require them and some don't, and that's up to the business. And it may be that if you're a business owner or you're on as an HR person or something, you make that determination in conjunction with your employees. I mean, everybody saw on the news that situation in Portland that happened immediately after the executive order, which, I mean, what exactly happened, of course, I don't know, but it seems like having some consultation with your employees about what the approach will be may not be a negative at all, and maybe a good idea. All right, so this is another big one. If we do require vaccinations, what do we need to keep in mind? Aside from everything that we've already talked about, this person asked specifically about what written policies are needed, what information needs to be collected or shouldn't be collected due to HIPAA, how do you go about collecting it, and where do you keep it on file? So some of these I've touched on, but let's go through that again. What written policies are needed? I think it makes sense now, if you haven't already, to go back and look at the policies that you currently have in effect, which I'm hoping were updated during COVID to address how the workplace was going to function, because it's time to update those again, assuming that you are bringing people back in. And I think one of those policies can certainly be, this is our position on vaccination. This is what we've decided to do, because obviously you need to communicate that to your employees. So if you have not already sat down and really thought through this whole question and come up with whatever your workplace is going to do, then now's the time to do that. And then I would expect, as a result of that conversation and that decision, you would be issuing a policy or some kind of notice to your employees about what you're requiring, and not just of employees, but also of people who come into the office. So for instance, like when we did ours here, we had a policy for employees, but we also let employees know what to expect from people who come in from the outside into the building, so that they would know how that was going to work. So yes, I do think written policies are a good idea. And also, you know, as I've said all along, your written policies are, you know, in the event that OSHA did come to your workplace to investigate whether or not you were meeting your general duty, your written policies are a very good place for you to start in showing that you have addressed these issues, that you are following the guidances, and that this is, your communication to your employees. What information needs to be collected or shouldn't be collected due to HIPAA? This is a question that has come up a lot. And so it's not a HIPAA violation for a non-healthcare related employer to ask for proof of vaccination. In fact, it's not a violation for a healthcare employer either if the vaccination took place somewhere else. So you don't need to worry about HIPAA in most situations if you are just asking for proof of the vaccination. There are obviously some exceptions about that. If you were to ask the employee's healthcare provider directly for information about their status, then you might get into issues with HIPAA, but just asking for the vaccination card is not going to violate it. I addressed before what information needs to be collected. And again, I'll reiterate, I think it's just the vaccination card. You don't need any more than that. And the beauty of that card is that it doesn't give you any protected medical information just beyond the fact of vaccination. And that's exactly what the situation you want to be in. Where do you keep it on? How do you go about collecting it, and where do you keep it on file? I addressed that briefly also. I don't think it's necessary to make a copy of the vaccination card. In fact, I wouldn't recommend doing that. But if you do and you keep it, it is medical information, and it must be kept confidentially as required by the ADA and a variety of other rules. So be sure that you are maintaining that in a confidential manner.
Sorry to interrupt you. Along this thread, a question came in that if you do require vaccination, could an accommodation for an unvaccinated employee be that they're required to continue to work from home? Like, so could you opt to not allow them to return to the workplace and instead just have them work remotely? Is that considered an accommodation?
I would worry that not allowing a non-vaccinated person into the workplace, especially if the reason they aren't vaccinated is a protected reason, could be viewed as retaliation. And in fact, most likely would be, because the CDC has not said that unvaccinated people should not be in the workplace. In fact, they're saying they can be, they just need to follow the same guidelines we were following before. So I would be very hesitant to exclude an unvaccinated person unless, an exception, I guess, would be, of course, if they have some medical reason why the doctor's saying you should not be in the workplace, then obviously remote work would be a good idea and an accommodation. Or if that person, for whatever reason, refuses to wear a mask, then you shouldn't allow them into the workplace. And so remote work might still be an option, but I wouldn't consider it to be a reasonable accommodation at that point, because their reasoning is not a protected reason. But be careful about retaliation claims for excluding people who cannot be vaccinated, because the fact is the CDC has not said unvaccinated people should or could not be in the workplace.
Thank you. And just one more, just staying on this thread. If you require vaccination and you're not using their card, but you're asking them to affirm, you're asking your employees to affirm their vaccination status, what does the affirmation look like? Is it an email or a verbal acknowledgement? Like what would that look like from your perspective?
Yeah, that's a good question. And none of these federal entities have actually said this is specifically what you need. I would envision almost like a sign-up sheet, like when you do a sexual harassment training or something, that everybody signs the same sheet saying I'm authorized to be here. So, or I'm confirming that I attended the training. So you could have a sign-up sheet like that and have people just, the top could be a blurb about, by signing this, I affirm that I've been fully vaccinated. And I think it's as simple as that. Or if you were concerned about, and I can see why there's a potential that there could be confidentiality issues if you had everybody sign the same sheet. I mean, I'm not sure that there would be, because everyone's going to know that they're vaccinated because they're not going to be wearing a mask anymore. So that gets a little wonky there. But if that was a concern, you could always do just one sheet of paper that had the little blurb on it, and so each person signs a separate one. But I think that's sufficient. I mean, ideally, you'd like to think that just going around and asking, or not even having to ask, just if you were to issue your policy. So let's say you were to email out a policy this afternoon, and you said the policy as of today and for ongoing is that any employee who is fully vaccinated no longer has to wear a mask. And by not wearing a mask here, you are affirming that you are fully vaccinated, because otherwise we are requiring that you continue to wear a mask. That should be good enough, but again, there's no guidance, so I don't know. I think if you wanted to do the most you could possibly do, I would say have that statement and have people sign it saying, I'm affirming that I'm fully vaccinated.
Great, thank you. And that gets filed with the rest of your HR paperwork?
I would put it in each person's personnel file.
Yeah.
Yeah, or
okay.
if you do the sign-up sheet like you do with a training, then I would just have HR keep it somewhere, in a locked cabinet somewhere, just like you do with those training sign-ups.
Great, thank you. I'll stop interrupting now. Please keep going.
Okay. I mean, I'm just answering I'm happy to answer anything. All right, so the next one that you would send is, if we do not require employees to be vaccinated, can and should we ask them about their vaccination status? And so I think we've talked about that already and answered that. Are there legal limits on what we can do to promote vaccinations to our employees? So yes, that's what I said before about the EEOC and the incentives.
Oh, the audio cut out, Anne-Marie. I'm not sure what happened. I can't hear you. I don't know if everyone else can. No, seeing head shakes. Okay.
Great. Can you hear me now? You had me muted.
We can, yeah, thank you.
I couldn't do anything.
Sorry.
That's okay. I'll try to get to the questions that I think are specific, but I wanted to make a couple of comments. First is that I'm not a lawyer, so I'm not looking at all the legal aspects of this, but I do want to make sure that people understand that the guidelines on masking post-vaccination do not apply the same way to healthcare facilities. So if you are a healthcare facility, long-term care, boarding homes, hospitals, there is a different set of guidelines which talks about what is appropriate post-vaccination, and it is much more stringent overall as far as what's required. So that, you go to a hospital right now, people are still wearing masks. A lot of those people are vaccinated, but again, that's a different setting, and I think it's important to emphasize that. I'm going to stick that reference. I think people probably know that. Because I know most of this has been more about the non-healthcare setting overall, but I'll just because if you look actually at the guidelines that are provided post-vaccination and what you can do in unmasking, it says this does not apply to healthcare and refer to this document. So if you are, that's probably important to emphasize. I also want to emphasize, and again, there really are very few religions that actually are opposed to vaccination. We went through that in all of the discussions around the vaccine mandates, which we had just prior to the pandemic overall. So which questions do you think refer directly to something that you want me to answer back there? Because I'm sort of looking through them. A lot of these are employment related.
Yep. There was a question about do COVID-19 vaccine injuries qualify for the National Vaccine Injury Compensation Program?
And I never like to answer something I don't know 100%, but I know about 85 to 90% that does. But I will check it and I can send it to you, Becca. But there's no reason.
Great.
There was no reason why it should not overall. And I just haven't seen it written that I could, overall provide you. But I'll look for that.
Sure. And I think I know the answer to this next one too, but I'll ask you anyway. Will the mandated vaccine law that is taking effect in September have any impact on COVID vaccine requirements?
No, the mandated vaccine law is a legislative mandate per se. And if you recall, that's really for school-related vaccines, and it was removing philosophic and religious exemptions. And so it made the mandates for schools are only for medical exemptions overall. And that really is the standard childhood vaccines, including varicella, DPT, OPV, MMR, and in a little later on, the meningococcal and Tdap. And so, no, that's not with COVID. I think one of the other things, and I'd be very interested in the legal conversation on this, is because these are not approved vaccines, they are authorized under an emergency action. What is the legal standing as far as mandating the vaccines? And I've seen it unfortunately both ways, but the good side of that answer is that probably within the next 6 weeks or so, these vaccines will be authorized. They are both at least the mRNA vaccines, both the Pfizer and the Moderna have applied to the FDA for full approval. And that, I don't know exactly the FDA timeframe, but it probably will be coming along.
Thank you. Anne-Marie, is your sound working now? No. Darn. I do have another question, Dr. Sears, similar. I think I know the answer, but I'll just, ask you anyway. Do masks protect vaccinated individuals in any way? There's some questions about whether if people are at work and they're vaccinated, do they still need to wear a mask to protect themselves from unvaccinated people? Oh, sorry, the unmute. Here, wait, sorry. Wait, you're muted. Yes, there we go.
Okay.
So many complications.
that's okay. This is the world of Zoom. We live in it.
It is.
It's probably the most commonly stated phrase for this entire year. Am I on mute? Anyway, masks are always useful in decreasing the transmission of COVID. If you are vaccinated, the reason that the CDC is saying that you don't need to wear a mask is you are protected. The vaccines turned out probably to be more effective than any of us thought and any of us imagined, and they're very effective vaccines. I think when I think about this question, it usually comes down to people who are immunocompromised, who've been vaccinated, because we don't know if the vaccine really works. And medically, I suggest that people who are immunocompromised continue, even if vaccinated, continue to wear face coverings, because I just can't guarantee that we've got that they've got effective immunity on board. And unfortunately, we don't have any really good way to test for that either. But really what CDC is saying is that you really don't need face coverings. There are some people I've talked to who say, well, I know it's not 100% and I'm still a little bit concerned, and there's no reason why you can't. What's really being said is that you don't need to.
Great, thank you. And I'll just ask you one more and then turn it back over to Anne-Marie. So for folks that are returning, if your staff is fully vaccinated, what are some considerations they should have? Can they use their kitchen area together? Do they have to take extra precautions around cleaning and, those types of things, or what's the guidance around that right now?
Sure. And again, Anne Marie said this early on, I really would refer everybody to the CDC document, and I can stick it in the chat box if you haven't seen it, because it actually does address small groups meetings and such. But basically, if people are vaccinated, they can have small group meetings. And, I think cleaning, we've learned a lot about how COVID is transmitted, and it's predominantly a respiratory tract virus. It is not from fomites. I think routine cleaning is, it should be expected in between, uses or in high touch areas, but otherwise we don't need to use all of the sanitation that we did probably, 8, 9, 10 months ago. I don't know if
Great.
Anne Marie's
Thank
back.
you very much. Thank you. And I'm going to see if Anne Marie sounds back on. No. Oh, yes, we can.
Oh, yay!
Awesome.
Awesome. Sorry about that.
Oh,
I
no
didn't touch
problem. That's
anything. I
great.
know that. All right, you can still hear me, right? Okay.
I
So
can.
I'm
Yep.
not sure where we were or where you want me to pick up, but do you have other questions you want to pose, or should I just go back to where I was?
Yep, that sounds good. Going right back to where you were.
Okay. Let's see. Well, so here I mentioned this briefly. This one says, what about liability insurance and workers' comp? Is there anything we should be updating, connecting with our insurance providers about? So liability, I don't really have the answer to that. I think what you would want to do in the event that you're concerned about having at any point what's going on in the workplace, you could certainly talk with your liability carrier and see if there's information they need or if there's anything you need to do in that respect. But there have been as far as I know, there have been a lot of cases that are still working their way through their system about COVID related coverage and whether it even has coverage and what, if there is coverage, what it's for. Most of the things I've seen have been for loss of business, not so much what happened in the workplace, although I know some of those are working through the system. But those cases may also be precluded from workers' comp because we're still talking about whether or not the ultimate issue of whether it's work related or not. What I can address is that if you have claims made, so if an employee comes to you and says, I got COVID and I think I got it because I was at work, then you would proceed with that just like any other workers' compensation report of injury. So you would want to let your carrier know, and they would file a first report and presumably a notice of controversy. And those are being done. Those are working their way through the system as well. I have several workers' comp related claims right now for COVID illnesses. And, the way we're handling them is essentially just like any other workers' compensation claim. In this case, the issue primarily revolves around, did the injury arise out of, or the injury or exposure arise out of and in the course of employment, just like in any other workers' comp case. But do not be reticent in reporting them. If you have an employee who says to you with any word choices, it doesn't have to be specifically, I have a workers' comp injury, but if they report to you that they have gotten COVID and that they think it had some connection to your workplace, absolutely let your carrier know, because then the timing starts and you need to get that notice of controversy filed. Okay, let's see. We're going to run out of time because there's several more here. I have read that it has been ruled legal for employers to require COVID vaccination for employees to keep their jobs. So we've talked about that a couple of times now. There's nothing that prevents you from requiring the vaccination in order for people to continue to be employed. But there are a lot of caveats that we've already gone through. And so I don't think we need to go through those again. Let's see. Can we require masks for all that enter regardless of vaccination status? Again, this doesn't go to employees. It's more to customers, I think, or clients. And as I said before, I think the situation is the same. You set the policy, you have to be clear about what that policy is, and you're not prevented by the CDC or the state's executive order from doing that. Given workforce shortages, how could employers' decisions, RE vaccination policies, impact hiring positively or negatively? Well, I mean, it could go either way, of course. I think, you know, you may have new hires who are more willing to come into a workforce where they know that everybody has been vaccinated. But on the flip side, you may very well be interviewing applicants who are not willing to be told that they must be vaccinated to come to work, or even reveal that status to you. So you know, that's a who knows, it might be positive and it might be negative. There's no way to know that. Let's see. So most of the other ones we've been through. The last one is quite long, and it's a very, very specific question about a particular employee. So I am not going to pose that to the group, because it's not a hypothetical, it's an actual employment situation, and I wouldn't even be able to answer it unless I did a conflict check first. So not to exclude it, but I don't feel like that's one that I can go through. So how about any other questions? Oh, I did hear during the discussion with Dr. Sears the reference to the EUA about the emergency approval, or whatever that law is called. So what I know a little bit about that, not too much, but what I know is that there is no answer right now. There hasn't been, as far as I know, there hasn't been any specific guidance on whether or not that prevents an employer from requiring a vaccination, nor has there been any prohibition saying that because of that you cannot require a vaccination. There has been kind of an interesting interpretation of that law, and I'll also note that that law is obviously predated COVID, so its applicability is also not as clear as it might be now that we have this new situation. But there was this article recently about the interpretation of the language of the EUA and the way that the term consequences in that law is used. Because what the law says is that individuals must be given the option to accept or refuse administration of the product, of the consequences, and of refusing administration of the product, and of the alternatives to the product that are available, and their risks and benefits. And so there's some indication that reference to consequences of refusing a vaccination includes not only the potential consequences, but also such as loss of employment. So, but nobody has given an actual ruling on that. So as of right now, the way I interpret the CDC and the state's executive order is that they are not precluding employers from having a policy of requiring the vaccination, because somebody could always say no. I mean, it's not, you're not holding them down and forcing them to have the vaccination. You're simply saying that as a condition of employment, you must have the vaccination. You can choose not to have the vaccination. And so in that sense, the EUA is not violated, because you're not forcing them to do it. It's just that if that's your policy, then they can no longer be employed by you if they don't have it. So I think that's the best answer we can give at this stage. And that takes us right up to the end. So that was quick.
That was a lot of ground. So
Yeah.
Thank you so much for covering a very wide range of topics, both just in your introductory, half-hour comment, and covering all the different questions that we received. Thank you. I think you answered the vast majority of these. And if folks do still have questions that haven't been answered, please let me know. And I also want to thank Dr. Sears for your guest appearance today, and for answering some of these other questions that went a little outside the legal scope, but nonetheless people had. So I do want to thank all of you for giving us your time today and for being here. I will hopefully get this recording posted either later today or tomorrow, and I will be sure to share the link with all of you, as well as with you, Molly, for MAMP to share with your listserv and with ours at MPHA. So Anne-Marie, again, thank you very, very much for your time and expertise today, and Dr. Sears as well. And I hope everyone enjoys the rest of your afternoon.
Thanks for having me. And I'm sorry about the sound issue, whatever that was, but thanks for having me.
No problem. Nope, it happened. We've all been there.
All right, have a good day.